Good morning, everybody. It's Pat Makokis here, and I'm sitting by my colleague, Dr. Margo Greenwood. Presentation has been identified. What's new is really old, trauma-informed health practices through an understanding of historic trauma. So let's get started here. So I think for myself, it's really important to position who I am in this work and how I came to be doing the work around historic trauma. I am Cree. I practice ceremony. I privilege Indigenous knowledge. And for me, that's a real honor to be in a place of giving our knowledge its rightful place within all of those spaces that we're working, that we all are trying to make changes around. I do reside on a First Nation, and that's at Saddle Lake. I'm married to Eugene. I'm mother to Janice and James. I'm Kukum to Atayao, and I very much see myself as a servant of our people. I've worked in the tribal college system for many years. I was connected to Blue Quills First Nations College, and I now work at the University of Alberta. Now, in getting started, I have to say I am somewhat nervous. I've done this presentation many times. That said, it's a bit different when you're sitting in front of a computer and doing it. So I need to slow down a bit and start by acknowledging the Creator and our ancestors who are always with us, and that today Dr. Greenwood and myself are Place Lee Tene territory and want to acknowledge that, and to acknowledge colleagues who are in Treaty 6, 7, and 8 that I've worked with over the years, and everybody who's online, because we're all here together today to come and spend a little bit of time understanding something that is really important and really profoundly rolling out in our communities right now. And it's the whole reconciliation. And as we're figuring out what that reconciliation is, we need to understand trauma. So I'm going to turn it over to Margo.
Good morning, everyone. Thank you for attending. We are sitting at the University of Northern British Columbia on a bright sunny day in Prince George, so it's really quite beautiful here, and I'm grateful for that. I too want to recognize the ancestors and unceded territories of the Lheidli T'enneh people and thank them for allowing me to be here on their lands to do this work for our people all over the country and with the people. I'm also really grateful to have the opportunity to work with Pat, Dr. Makokis. It's always a pleasure working with her and learning from her and with her. So thank you, Pat, for that. So I'm really excited by this topic. I think this is a wonderful opportunity for all of us to learn and to share ideas with one another, because I suspect that everybody online today has a story to tell around this. And I think today Pat and I are going to share some of our little stories with you as quickly as we can, because we know we only have 45 minutes. But want to share some of those insights that we've learned, I think, over the years and working with our communities over time and in other organizations, and what that looks like and how that feels. So I'm going to stop there, and Pat,
okay, let's roll on. All right, let's do it. All right. When we put the abstract together, I talked to Margo and I said it was really important that we do this for our community, that we would help our communities understand the importance of this whole area of historic trauma. And so there are some assumptions on my part, especially because I live in the community frontline. So in that process, understand and can look at community through the eyes of understanding this. So that's the assumptions, and that we're coming to this place of wanting our community members to have a deeper desire of understanding the trauma. So in a broad perspective, it's looking at that adversity, but through the sense of resilience, and to look at those colonial impacts and how is historic trauma rolling out? How do we define it? How do some of our scholars look at it? And what are those frontline impacts that we see that we need to be able to identify? And in looking at the literature, and this is where Margo, her work around trauma-informed practice, in looking at that literature, it's really ironic because it's the latest of buzzwords, so to speak, but really when you look at it, it's really validating our own knowledge systems because it's going back to that. So I'm not sure if you want to say anything on that, Margo.
No, I think that, I mean, that's the case. You know, when we listen to our elders and some of the teachings and some of the circles that I've sat in, as I've listened to the teachings, and I've had the opportunity or the privilege to read some of this other literature in the academy and different places, I'm always struck by the similarities of where we're trying to get to and what underpins this trauma-informed practice around, you know, the respect for one another and our contexts and our histories. So I'm hoping Pat and I will be talking about that throughout this whole presentation.
Okay, all right, let's move to our next slide. So there's, on this slide, you're going to see that we're asking you to imagine that we're all sitting in a talking circle right now. If we were in a community, that those chairs would be in a circle, and that as we're sitting there, that we're putting our minds together. And as we're doing that, I want to contextualize this a bit, because back in the late 90s is when I started to take a look at this work. I looked at it through the eyes of our students dropping out of provincial high schools and what that was all about. And back then, I was doing a presentation actually in Treaty 7 on this. And I remember standing up, and there was a huge room full of people saying, you know, this is not going to be comfortable information to go through, but we need to go through it, because in order to understand what's happening in our community, we've got to start talking about the pain and the woundedness. And after I finished the presentation, an elder from Treaty 7 came up to me and he said, Pat, you can never stop talking about this. So as we start to contextualize this, I want to imagine that we're all sitting in a circle, and Margo and I put an object in the center of that circle, and we're all describing what we saw, that everyone would see it from different points of view. Some would even see opposites. They would be sitting on opposite sides of the circle. In other words, you don't have to see what I see for you to be right. In fact, everyone in the circle is right based on their own point of view. If we're willing to listen to everyone's point of view, then we can get a more accurate description of the object in the center. This is one way to put our minds together. When we get the clarity from each other, we should give thanks and be grateful to each other. So if we can imagine now that we're in that talking circle and we're starting to have this conversation around historic trauma, and imagine our communities, and we're wanting to put our communities there and put our, as one of the elders that I worked with many, many years would always talk about, he would say the greatest journey we have to make is from our head to our heart. So as we do that, let's imagine that we're lifting up our communities and we want to understand this topic. All right, we know that the National Collaborating Center for Aboriginal Health, Margo and her team here, take a really strong approach around the social determinants of health. So if we can imagine this complex situation that's rolling out right now in Canada, as looking at that iceberg on the left, if you see the screen, you see this big iceberg. And when I started this work around dropouts, this was the metaphor that I used. I imagined that the students I was working with, they were at the top of that iceberg. And to understand the complexity of what was happening as to why our students weren't finishing school, I had to look very deep into our community and what the complexity of creating student success. So look at that iceberg and know that those are the social determinants of health that the Collaborating Center has done a lot of work on. And so when we look at the health of our community, we cannot look at it through just a one lens approach. We have to look at the whole community, what's rolling out in our community in that perspective. So the client that comes into your office, you must look at the bigger picture. So think about this iceberg. And the picture on the right speaks about speaking the truth, even if our voice shakes. If we wonder sometimes why we feel this sense of nervousness and we're scared, in this process of coming to understand the complexity of history in Canada and the colonial history, which has been the biggest secret of all, we have to start having conversations around what our community members have experienced and continue to experience. Things like racism, thinking about our education and how the Western education that we have had to be a part of has indoctrinated systems of thinking, and at the expense of privileging white knowledge, white privilege, and our knowledge systems have been missing in that process. And that's something that we're in our infancy around in this country right now, because as we think about truth and reconciliation, the first thing we have to start thinking about is our truth. What are our truths around some of these things that we're experiencing and that are going to roll out over the next few years that our communities are going to start talking about, and Western systems through the calls, the truth and reconciliation calls to action are having to look at. So be mindful of those conversations that we're going to be going into. Here we have a picture of Thomas. This is a famous picture that you can go online and you can take a look at who Thomas was when he was a young boy and went to residential school in Manitoba. And you can see that that's a very cropped picture. But when you look at the picture of Thomas on the right-hand side, you see that Thomas had to profoundly change who he was. He wasn't good enough to be who he was on the left. He had to change his whole identity. So that sense of indoctrination that we have to start talking about, identity issues, our people being considered savages, our people being considered inferior, and in bold red writing there, you know, we have to think about what it was that we were taught in school and how that impacts us till this day. And that in that process, our knowledge systems have been invisible. And at the bottom you see I have this PhD and the question, why didn't I know about this? So in order to contextualize that or explain that, I want to go back to a time when I was working at Blue Quills First Nations College, and we were doing professional development. In a closing circle, there was a Caucasian man who started crying, and he said, he had a PhD in history, and he said, why is it that I don't know about this information that you've taught me? I've lost out. My children have lost out. My family has lost out. And I would suggest that most Canadians have lost out, because if you take a look, the essence was taking the savage out. And I remember the late Joe P. Cardinal joking about this one time working at Blue Quills, and he said, we're here to put it back into you. So essentially, our knowledge systems to come back to us. So this next slide, we have a picture of Dr. Maria Yellowhorse Braveheart, and I'd really encourage you to take a look at her work, because in our definition today that Margo and I are taking, she talks about historic trauma as the cumulative emotional and psychological wounding across generations, including the lifespan, which emanates from massive group trauma. And I would really encourage us to think about not using the word dysfunctional, but using the word wounded, because what we see happening in our communities is a deep wounding that we are coming out of. And that wound, when we use the word like dysfunctional, they're harsh words, and it's a woundedness that is coming out of unresolved grief and trauma. That is essentially what's rolling out in our communities right now. You see a picture, this next slide, that's Blue Quills, that picture. And Blue Quills was an old Roman Catholic residential school. And in the bottom you see the children literally being picked up and taken in trucks. Those trucks would go to the churches, and they would go to the communities, load the children up, and take them. And on the right-hand side, you see the result of this history of the residential school, of the physical genocide, the mass killings of our people, the biological genocide, the destroying of reproductive capacity, cultural genocide, the destruction of our practices, our governance structures, our systems, land being seized, populations forcibly transferred, languages banned, spiritual leaders persecuted, our practices forbidden, families disrupted from value transmission, and so forth. I think that these are things that we can never forget. And some people would argue that we shouldn't be using the word cultural genocide. And we need to remember that this is a critical aspect of what we're trying to work our way through now. So John A. Macdonald in 1874 said that the Indian children should be taken away from their parents so as to evade their barbarian influence and expose the children to the benefits of civilization. The teacher has been sent out as an educational missionary to introduce cultural changes in Indian societies. And ironically, right now, I believe there's a new $10 bill that's coming as part of the 150th anniversary, and John A. Macdonald is on that bill. So it's interesting to know that this is being perpetuated again. Duncan Campbell Scott was one of the administrators of the government, and he's quoted as saying, "Our objective is to continue until there is not a single Indian in Canada that has not been absorbed into the body politic, and therein no Indian question." So back in the day when I started doing this research, this I found extremely disturbing because it was proof of the government's full intentions around our people and what was going to roll out over time. Dr. Peter Bryce was a medical officer, and his work, you can take a look in this book, A National Crime. He was responsible for inspecting residential schools, and what he found was significant overcrowding, inadequate living conditions, and essentially what happened to him was he was fired. And you can take a look at the article, the website at the bottom, take a look at that book, and you'll find this information for yourself. So this gentleman found out what those living conditions were like, and when he found that out, his report was met with hostility, and he was terminated. Now, take a look at this book. This book called Colonized Classrooms, Racism, Trauma, and Resistance in Post-Secondary Education by an Indigenous scholar. She's talking about learning this history, that colonization is violent, it's ongoing, and it's traumatic. This violence continues to shape current practices, behaviors, and responses. So the question, How important is it for all of us to understand trauma-informed care and practice? Now, Margo is going to cover the next several slides as we look at the question that we've posed here. How important is it for all of us to understand this practice? Okay, so if you look at the literature, the question then becomes, why? Why is it important for us to look at this current literature on trauma-informed care and practice? Because when I started to read this literature, it was really looking at our own knowledge system, our own way of being. And so the question that I asked here is, why? People who have experienced trauma are at risk of being re-traumatized in every social service and healthcare setting. For example, and we will talk about this ACE study down in the slides ahead, but that ACE study looked at, it was a study in mainstream America, and you need to Google that study because what it talked about, it blew my mind when I first found this research, because it was about middle-class Americans in the United States, in San Diego. They looked at, some doctors were looking at health outcomes of middle-class Americans, 17,000 in fact, and they found that they had poor health outcomes, and they looked at their lifespan around the trauma that they experienced as children, and they were in their 40s and 50s, and the rollout of their ill health. So when you start to think, if mainstream America were experiencing trauma as adults, ill health as a result of trauma in childhood, then what would the same question be for our people having gone through residential school and then the generations coming after? Then the question is what? So regardless of their primary mission to deliver primary care, mental health, addiction services, housing, etc., their commitment is to provide services in a manner that is welcoming and appropriate to the special needs of those affected by trauma. So Margo works frontline in healthcare, so she's going to share some examples at this point.
Well, first of all, I don't work right on the front line, but I certainly have had the opportunity to talk to a number of people who do work on the front line in the healthcare system. And I've also had the privilege of talking to some of our community members across the country. And sort of over that time, I've gathered up some stories and understandings of what occurs, and from my own experience as well, and my own family's experience. I just recently, there was a question posed to myself and a colleague, and it was a question around, going and accessing healthcare services. Some of the learning that came out of that was, when are people, say, enter a tertiary care hospital or, a doctor's office, or, enter into the healthcare system, people are vulnerable. They are vulnerable to begin with. They're not feeling well. They're unhealthy physically, and they could be, experiencing all sorts of trauma, emotionally, physically, mentally, all of those things. So knowing just first of all that people are really experiencing that kind of vulnerability. And so then imagine, as I talked to some of the others, they talked about the absolute fear. I am not going to that hospital till I absolutely have to. It's terrifying. People die there. People don't come home again. So that whole fear around some of these institutions, and no surprise, given what Pat said to us and what's occurred for our people sometimes in those bigger systems, health systems. So there's that fears, there's that piece of information. And then when you walk in and you start to, you're in that space, you kind of look around and say, this doesn't look like my space. I don't see anything familiar here to me. And I hear that it's like walking into another world for some of these elders and community members. Like, you know, how do I be in this space? Because there's no one kind of there to guide you for a lot of the, you know, as you enter in. And then I think what becomes really important is what happens there when you meet another person. How are the people greeted? How are they informed about what will happen to them in that space? And that, you know, it's that personal interaction, and that's where we start to talk, and we will talk more about this stuff around cultural safety and cultural humility and all those sorts of things. Well, how are we then in relationship? So I think it's just kind of understanding and knowing that, you know, that history. So you know that what people are bringing with them as they enter into those spaces that are unfamiliar to them.
All right, so that's a good segue into the next slide around those service providers. In an ideal world, what those service providers would do.
Yeah, and that would be to realize that widespread impact of trauma and understand the ways for healing, to recognize the signs and symptoms of trauma in staff and clients and patients and residents and people and others involved in the system, and to respond by fully integrating knowledge about trauma into policies and procedures and practices. And I'll just divert just a tiny bit here to say that I feel very privileged to be living in the province of British Columbia, to being able to work with the health authority, the Northern Health Authority, and to be part of working in partnership with the BC First Nations Health Authority. And just recently, there has been a declaration signed by all of the CEOs of the health authorities in the province around cultural safety and humility. That's a huge piece of work that really sets the model and the process for beginning to address some of this trauma and responding to it from an organizational level as well as an individual practice level. So we've had the privilege of working in a new relationship with BC First Nations in the province. A big part of that work is about engaging community. If we're talking about different knowledge systems and systems of knowledge coming together and interfacing with one another, we know that those knowledges live within our communities. And we have to work in partnership and collaboration in order to realize those knowledges, privilege those knowledges into a system of care that is going to be much more responsive and respectful of all those seeking that care. If we can work in that collaborative partnership, privileging each other's gifts and privileging each other's knowledge.
Great, which moves us into essentially the core trauma-informed principles.
So on the left-hand side, we're facing the screen, so it's our left. You have a list of values and principles, if you will, that can guide our practice. Values and principles, to me, are like touchstones. When I've been taught the teachings by the elders, and some of them I see here in front of me, and there's others, I always go back and whatever I'm doing in my practice, whatever that might be, whatever environment I find myself, I say, am I living to these principles? Am I providing safe and respectful care? Is the relationship I'm establishing trustworthy? Am I trustworthy? Am I trusting of others? Or do I have a bunch of walls up and biases that are preventing me from being able to be trustful in a relationship? What about power? What about choice and control? How am I sharing that with the person I seek to serve? If I'm a health practitioner and I'm speaking from that place right now, how am I sharing that choice and control with those I seek to serve? Where are their voices? How do I privilege their voices? Am I compassionate? Just recently, we had a conversation around what are our strengths and our gifts, because oftentimes what we see is the negative all the time. The we can pick up the paper, we can, any conversation, there are negative things out there, but far less conversation, I think, overt conversation anyway, about the strengths and the resilience that we have and the gifts that we bring. Because if we really believe in our strengths and our gifts from each other, then collectively putting those strengths and gifts together makes a powerful relationship and gives us a whole world of possibility that we would never have known unless we can enter into those relationships and realize those gifts.
So we're going to move a little bit here into our community and some of those internal and external challenges. And the pictures that you see before you are examples of a number of years ago, I was asked to do some work with our young people. And they were between the age of 12 and 17. And I was asked to teach them a little bit around leadership, around basics of culture. And I thought, how am I going to do that to help this young group and keep them actively engaged? So what I did was I used putty. So on the left side, you see the putty of a child or several children. And what I asked them was a couple of questions. I asked them, what makes you sad? And then I asked them, what makes you sad within our community? What makes you sad within our family? And so we sat around the table. I put the putty in the middle, and I just gave it to them. And these are examples of what made them sad. So you see the red is a fist, and the other one above it is a bong, and you see a family, and you see tobacco there, because I was teaching them about those relationships, that they had knowledge and gifts to offer. So I wanted to teach them about tobacco. So I gave them tobacco. Then we went through this process, and what I walked away with is understanding from our children those internal challenges that we face around trauma that's rolling out, even with our children. For example, were the family violence that we are experiencing, the addictions to drugs and alcohol. And what I found was that the children, they really wanted only two things. They wanted to have the love and the connection with their families, and they wanted sports. They didn't want money, they didn't want a whole bunch of technology, but they wanted those relationships. And this trauma that's rolling out in our community is created this pain that we need to understand. We need to know the source of it so that we can collectively within our communities do what I would call a collective lift, because that is rolling out in terms of that internalized oppression, marginalization, and lateral violence that we experience in our own community. Now, the picture on the right is ironic because in my years of working at Blue Quills, I always loved this picture, because what it really depicts for me is the fact that we need to work internally in our community and privilege our own knowledge, our own way of being, but we also need to work with others outside of that system and to be able to share power and a willingness to find a way and to challenge that status quo. This next graphic, over the years, the elders, again, have been wonderful, loving, caring teachers for both Margo and I. And this depicts a teaching around the natural laws of Creator. And you can see that from the picture, there's a tree at the top that represents honesty. And over to the far right, you see the buffalo, which represents our teacher of sharing, the mountains at the bottom, which are our teacher of strength and determination, and over on our left is sweetgrass, which is our teacher of kindness. And all of these, and I say this, there's hours and hours and days of teaching that our elders can do and do around this. But these are core teachings for us. And when you put that together, you essentially have the pipe. You have the tree as the stem of the pipe, the rock or the mountain as the bowl of the pipe. You have the sweetgrass that you light the pipe, and the red arrow depicts the sweetgrass path, the sweetgrass, the good road that as we come to terms with understanding trauma, we're going back to the teachings of our own elders who have helped us to reclaim these. And these sources of Indigenous laws come in our songs and our ceremonies and bundles and sacred sites, our medicines. And those are in our communities, in the various nations. We have these elders that have, thank goodness, have held on and have been resilient and strong, and they tie us to our own ways of being. And again, on the land, these teachings are embedded on the land, that the land is our book. The elders say, you know, go to the land, that those are our books, those are our teachings. So here you see this is an aerial view, and if you look closely, you see one of our teachers. And I'm not going to go into details on that, but just know that in all the areas, wherever you are across the country, there are teachers that know these. So if the land is our book, how do we learn that together? It means we go back to, for our own health and wellness, to our own ways and learn those. So Dr. Paparanga Reid talked, I listened to her in 2008. She was at a diabetes conference in Vancouver, and she was very candid when she was talking about the rollout of colonization. She talked and said, we need to know the power of colonization because our realities have become myths. The dominator stories have become the reality, and that this colonial history is transforming nations. We become insiders and outsiders, which results in resentment, frustration, and anger, for example. It impacts us socially, politically, economically, and we have social breakdowns in our community. We experience this lateral violence. And when we understand this, then we can start to build and lift up our community and start to talk about the things that are hard to talk about because they're impacting the growth of our own community. And one of those ways that she talked about that this leads to high crime, it leads to high risk behaviors. And what all of this really means is that the woundedness that we see and experience and sometimes is that become normalized is not who we are, but we must understand the source of it and talk about it in respectful, kind, loving ways, practicing our own teachings to come out of it. Dr. Marie Batiste talks about cognitive imperialism, and she says, when Indigenous knowledge is omitted or ignored in the schools and a Eurocentric foundation is advanced to the exclusion of other knowledges and languages, these are conditions that define an experience of cognitive imperialism. In other words, that knowledge system is it's superior to ours. Ours is pushed aside. And in this time of reconciliation, we need to privilege our knowledge in all of our workplaces and all of the systems that we are working in. I've already spoken about this adverse childhood experience, and due to time, I think that we're going to just move past this. Know that it's there. Google it. You've got the authors here, because when you take a look at this research and you start to think about how trauma is impacting our community, look at our rates of diabetes and heart disease and other illnesses in our communities, then it would only seem logical that the trauma that's rolling out is significantly impacting our communities. And then they give examples. You can go to that website and you'll see that they actually have an assessment that you can take a look at. But look at these, how they identify the abuses here, and then they scored them. so that when people that they were looking at this research with, they were asked to score if they had ever experienced these. And I believe there's 10 items here. And all you needed to experience was one. And look at the list. And I would suggest that some of our people would score a 10 out of 10 on this. And this is the rollout. If you look at this graphic, those adverse childhood experiences that are at the bottom lead to all of these ill health, which can lead to early death in this graphic. So go online, take a look, read those articles, and start trying to think about the services how we could use this information to help our community. So all of this results in losses and this unresolved perpetual grief. And really this picture depicts that. We have to unlearn what's going on in our community around shame, that internalized pain, the loss of self, of self-worth, identity, the loss of our parenting skills, the infighting, the gossip, the family feuds, the self-harm, the oppression, because the academic research speaks to the fact that oppressed people will turn around and oppress our own people. And I suggest that as painful as this may be to hear, that could it be that sometimes we have normalized this now in our community when it's the deep rootedness of the pain and the unresolved grief that we need to talk about and start figuring out plans in our communities with all the health professionals and community helpers to work on, which of course can lead to workplace bullying, and this picture depicts that crab in the bucket. So instead of lifting each other up, sometimes we're dealing with put downs and those feuds that continue, sadly, to do harm in our community in terms of the work that we need to do, which can result in these disrupted attachments individually, within our families, within our communities. So if you look at this slide, at the individual level, you can see a sense of isolation and alienation, shame, anger towards our parents, some self-hatred, internalized racism, fear of authority, which Margo spoke to, because when there's that fear of authority, how do we feel comfort to go and seek out help, which can sometimes lead to those destructive behaviors, identified here as substance abuse, gambling, alcohol, which in turn can lead to some of those abuse issues. And if you look in the center, the family, the unresolved grief, the parenting challenges, the violence, and then if you look over in the community and those losses, of course, the connectedness to language, to tradition, to that collective support. So going back and finding our elders and working with our elders to work on some of these painful issues. So how do we walk the path together to respectful relationships? And that's about integrating those approaches of working with Indigenous and non-Indigenous allies in terms of individuals, families, community to address those relational stressors. Here is a picture of a carving that depicts some of our teachings from our elders who say that we have to work together. We are all related. And it's a collective learning journey of what I would say that it's removing those shackles that bind us, the pain that we're having to work through. These, again, are a different way of acknowledging our own knowledge systems. These are carvings that are done by stone carver Stuart Steinhauer from Saddle Lake, who is depicting in these carvings our knowledge system. And we need to see these. These are not just art. These are samples of our teachings and our knowledge, that when people start to see these, going to beg the question, what are these? What do they stand for? What's in this work? What is being said here? Because when we see these, especially in times of reconciliation, and if we see the work, things like this all over this country of our people showing our knowledge systems, then it's going to invite others to start to think about, what do these stand for? What is it that we didn't see in those books, in what we lost, in what we weren't allowed to share? So these are depictions of that. I want to very briefly talk about some of the work that at the University of Alberta as a proof that we need to challenge Western institutions and support our own tribal colleges around our knowledge. This is an example of a program that's designed, taught between Indigenous scholars and elders, being land-based, and it's threading our Indigenous knowledge with Western knowledge, but it's privileging our knowledge. And these type of programs need to be across this land, where our knowledge becomes core and foundational to programs in medicine and law and nursing and all of the programs, education, so that it's foundational, it's not a one-off, it's not a tick the box, but everybody in this country is going to have to learn and can do it in a good way that invites everybody into. Dr. Reagan talks about, in her book, Unsettling the Settler Within, and go and find this book, because this lady talks about the need for us to have good relationships. She challenges us to say that all people, Indigenous and non-Indigenous Canadians, need to take that genuine leap of imagination to guide our steps today and into the future. In reality, institutions don't lead social change. It's us as people. So we need to be doing that reading and building those relationships amongst each other. So we're in this together. It's our collective responsibility. We need to remove fear. We absolutely need to work together. And one of the elders that I worked with for many years, what he had said one time at a very important meeting, he said, there's a window of opportunity right now, and we must take it. And I think that Margo and I would like to conclude by saying that that window is here right now. We need to keep it open. We need to find those partners, Indigenous, non-Indigenous, to find ways, creative ways, to bring in those calls to action forward so that we can do good work collectively within our communities and external partners.
So again, thank you for attending this webinar. I can see you all in the circle. I always say that to my children when I'm on the phone with them. I can see you. I guess the last thing, and Pat, you're absolutely right. We do have a window of opportunity. I know that, I could go to a really skeptical place and say, well, it's really not happening. But I don't believe that, because I see it in different places. I see it at the community level. I see it at organizational level, where people really are committed to creating the kinds of transformation and change that needs to happen. As an Indigenous person myself, I know that we have lots of work to do in our communities. I see that too. I experience that. I think we have to be courageous in this journey. We need to hold each other up and be courageous, because there are lots of things to face, and they're not always pleasant, but some of them are quite celebratory. So I always keep that in my mind. I think of, working in a non-Indigenous organization, I see the commitment of people, and I believe in them, and I trust their commitment to this kind of work, and that it's a journey that we're going to walk together. And I'm really hopeful. And at the very least, we need to stop that perpetuation of racism and marginalization and social exclusion and all those things, because that's how this historic trauma is rolling out for all of us. And I think we have to face that and be courageous there again. But I'm encouraged by especially when I hear Pat talk about the collective lift. We're not going to lift alone. We're going to have to lift together. I trust the people around me and the people I interface with to do that collective lift. So thank you. Thank you so much for being here.
Yes, thank you for listening.